on real estate
affects the market as a whole, which then sometimes will affect the 10.
Right. It'll come in.
to real life.
We all learn in different ways. If you think about it, Wayne Dyer might not attract everybody.
And everything in between.
Mission was really to help people just to reach their full potential.
The Brad Wiseman Show. And now, your host, Brad Wiseman.
All right, here we go. Another show. Hugo, another show. You know what? You don't have a microphone today. I forgot.
They can hear me.
They can hear you. You got a big mouth. That's right. But no, we got a good show lined up for you tonight. Thanks for joining us once again. We appreciate that. I met these two ladies. Well, I met the one a while ago, but I met the other one at a party I was at recently. Now, that doesn't sound good when you start out. I met these two ladies at a party. That doesn't sound good at all, but it actually was good because I know them. And they have this company called Skin Sanctuary Med Spa and Integrative Health. And we got into a deep conversation over having a couple drinks, and it was really cool. And I thought, you know what? I need to get you in to do a podcast, which is pretty much how most of my conversations go after talking to somebody. But let's bring them in. We got Jemika over here on my left. Hi. And Mary Kelly, or Mary. You want me to just call you Mary?
It's everyone calls me Mary Kelly. It's Jess's fault, by the way.
And Susan McFadden's fault. I think she calls you Mary Kelly also.
Yeah, a lot of people do. They think it's my whole first name.
Yeah. Well, at least it's just Mary Kelly. It could be like Mary Kelly, but something else,
fine.
you know.
And they do the same thing to my son in school.
Yeah.
Yeah. It's
That's
so
amazing.
Weird.
Yeah.
I know. It's a weird Kelly thing, I guess.
Well, we'll just do the whole Mary and Jemika. How's that?
That works.
Perfect.
Yeah. So we had a great time at the party.
It was amazing.
Yeah, it was a good time, right?
I mean, that's, definitely one for the books.
Yeah,
right?
it was.
Yeah.
Absolutely. And we had talked about, so at the party we talked about I was going to have Botox done. And I decided the next day that I was out of my friggin' mind because I'm thinking, it's probably not a good idea to do that on the show.
See, I totally disagree.
She disagrees. She's got everything.
I brought it all.
You even said you brought the ball to squeeze, so in case.
Yeah.
Oh,
I brought the little vibration tool because I was like, I don't know how tough he is. I don't know what to do.
What's the vibration tool about?
It's just like a little vibrator that you put on your face. It's like
wow.
bar,
Maybe I should have said yes.
Endings. I know. I would have been. See, I had a lot of fun planned for you.
Yeah.
So,
Get out of here.
Would have been a good time.
I know. Darn.
This has gone weird. But no, it's all good. But no, I decided not to do it. But it's not something I won't do. And maybe sometime we'll bring you back and we'll do it then.
Yeah.
I just feel like it's a lot to do in one show.
It's so
I was like, yeah.
It's so easy. But you had me all excited.
I know I did. Yeah. I know you did. We're going to do it on this guy instead. We'll do it on this thing over here. This is what we're going to do it on.
Yeah, there you go.
Okay, so tell me a little bit about your company. What do you guys do? And then we're going to go deeper into different categories of things.
Okay. So a while ago, almost 7 years ago, I had started a company with our medical director, Bella May, Aesthetic Injections. And then Jemika and I met. And we hit it off a couple years ago, and we were like, gosh, we need to partner together and do something.
Yeah.
So we started Skin Sanctuary Med Spa. So basically that company, we trained other injectors. I don't even know at this point how many people we've trained. Injectors,
Yeah,
that's
they are.
nurses.
Yeah,
well, they're not all nurses. Some
Right.
are, it depends.
So there's people that learn to just do that,
Yeah.
that are not nurses,
No,
obviously.
you have to be. Yeah. So
Okay,
minimal is a nursing license.
Okay.
So it's nurses, dentists, nurse practitioners, PAs, physicians. So that's it. So that's
Okay.
the level of what we train.
Gotcha.
So, and then some of them would just go on their merry way and work for other people. And then some would contract with us under our medical director. So as of right now, there's 9 of us across Pennsylvania.
Interesting.
And so, so that's kind of like
it?
how
9?
9. Well, we were up to 13 at some point, but sometimes we had a couple gals in Pittsburgh, but it's better when they're a little bit closer because then we can do a little bit more hands-on with them. Like
Oh, that's 9 that you're with, you're
that
saying.
we've, that contract with us, but we've trained more.
Oh my gosh, that's crazy.
We've trained a lot. We've trained probably in a year over 50 people.
At least.
Yeah. But I mean, again, right at this point, we have 9 that contract, and they're at different locations in Pennsylvania. Yeah. And so, Jemika and I and our medical director, especially Dr. Taranath, really big into lifestyle medicine. So we were like, okay, how do we introduce this? That was always kind of part of the plan.
Sure.
So we were at Skin Sanctuary Spa right in West Lawn and decided to move out into a bigger building. So we just send facials and massages back to that day spa.
Oh, that's cool.
So, we brought in the integrative health, which is, the functional medicine piece, the weight loss. We do like nurse health coaching. It's just like, and Jemika will speak to that with functional medicine and kind of what that looks like. So
there's so much with this, and it's not something that's been around forever.
No.
Like I mean, I know there's been probably pieces of it have been around. I mean, Botox has been around forever, and we always used to think of Hollywood.
Right.
Now Botox is actually more to the common people, if you want to call it that. Like seriously, years ago, it was the stars. Right. I mean, that's what you heard of.
Right.
And now it's here. I mean, there's many people doing it. So let's just dive into that first, because that's the one that, well, actually a lot of things that intrigue me in here, but that's the one that really intrigues me. How did it get to the point where a lot of people are doing it? It's become more accessible.
Well, it's definitely become more accessible.
Yeah.
More people can afford it, but also it's safety record.
Right.
Oh, okay.
So I think people a long time ago, it was just lack of education on the topic and things like that. Also just kind of marketing. I mean, Allergan was amazing. They were the first ones to, market a brand name of Botox.
Yeah.
And they brought in their Juvederm line, and that was the game changer. I mean, that really is what catapulted this industry, into what it is today. And it grows a lot every year.
So it has also evolved.
Oh, yeah.
So from what used to be what we call Botox, and Botox is that the actual that's not the unique name. That's like a name for like a brand.
It is.
So it's kind of like Kleenex. It's the same. Okay.
Mm-hmm. Same.
So is there a term for it that's not Botox? What do you call it otherwise?
Botulinum toxin neuromodulators.
Yeah, that's probably why they call it Botox, because that is something we're not going to talk
It's a
about.
brilliant name. Brilliant.
Yeah.
It is.
Absolutely.
Yeah.
So it has evolved.
It has. And actually, since Botox came on the market, there's been multiple others that have been created. So it's kind of like the original recipe.
Right.
So there are better ones out there. We don't use Botox brand.
Okay.
We use one that has a lower immune profile so that it's a little bit safer and you don't build a tolerance to it. And for people with autoimmune conditions, I'm type 1 diabetic.
Yeah.
It's a little bit safer.
Interesting.
So we tried to pick things that are as closely related to, your own body as possible. Like the filler we use is very closely related to, or looks a lot like your own hyaluronic acid under a microscope. So, so we choose those products based on that. So
that's amazing.
But I mean, it's just evolved into a million other things, I mean, collagen stimulation, being probably one of the new, I hate to call it new, but
is that the peptide stuff? No, that's not it.
No, that's more like microneedling. That's like we'll draw your blood and spin it down and get your plasma. It's called PRF.
Wow.
We'll microneedle that into the
That was
skin.
one of the things. Is that PRF?
Yeah.
See, I feel like I'm on a quiz. That's one of the things on my little
amazing.
quiz on my quiz sheet.
It is.
So they spin your blood to get your. What are you getting out of that then?
PRF, so it's platelet-rich fibrin. So basically, collagen is built on a fibrin matrix.
Okay.
So we're taking, when you do microneedling anyway, it kind of makes your body flood the area that you're microneedling with your body's own PRF, but then we're also drawing it out of your bloodstream, spinning it down in a centrifuge, and then just adding that much more of that response. Right. So it just elevates that collagen stimulation that much more.
And what is that for then? Is that for wrinkles or no?
It is. It's for everything.
It's for everything.
Everything.
Yeah.
And when you say everything, like give me other things besides wrinkles.
So like the hair restoration.
Oh, I need that.
Oh, it's amazing.
I did read about that. That we need to talk about.
Yeah, it's
Yeah.
incredible.
Is it really working for hair restoration?
Yes,
it's
it absolutely
amazing.
is. Men and women alike. So it's
Really?
not targeted to just one specific gender either. So.
But what do you do? Is that injected into your scalp?
It is. Yep. It is.
Wait till they're on next time. I'm gonna have a full head of hair, Hugo.
Oh my God.
I'm gonna be looking like I used to up there.
say.
That's me up there, just so you know.
Listen, I showed her your video, by the way.
Oh, that's right. You
She
did see.
did.
Yeah.
She showed
Yeah.
me.
Yeah. So that is amazing. So that's what that's used for also.
Right.
Right.
Yeah. And
Unbelievable.
they use it actually in dentistry a lot, and they use it in orthopedics too. So,
Yes.
I mean, for like
Unbelievable.
post-surgical joint injections, it's kind of, I mean, there's nothing more healing or more powerful in healing than your own body.
Yeah,
It's just
absolutely.
under the right circumstances.
Yeah.
If you have a healthy body, it's an incredible healing machine.
Amazing.
Yeah.
So now what? So tell me with Botox, how does that work? Are you going to show me with this guy that doesn't look so good? Or he looks like he had way too many things done to his face.
things, right?
Yeah, well, he's missing his skin, so that's kind of
that's a
the
problem.
Major problem.
That's a
yeah.
major problem.
So really, everybody
Why don't you
thinks,
bring it over this way? I
so you
think
can
at this
see
point,
better.
I know before we told you not to do that.
Yeah.
Now I
that's
think
okay.
And everything's a little
Well, there we
opposite
go. We
here.
gotta
So
do-
it's, there you go. There you go. There he is. Let's call him Stanley. How about that?
Stanley.
Yeah.
There you
Stanley
I
is
like that.
is
I have
here.
a nephew named Stanley. That might be a little weird.
Okay. Okay.
So Stanley. So basically, a lot of people think because your skin, you know, the wrinkles relax and everything that
Yeah.
you know, people think that you're tightening something.
Yeah.
You're actually relaxing the muscle. So repetitive facial movement over time is what makes static lines. So when you move your eyebrows up and down and you have lines that form, those are dynamic. But if you do that through your lifetime, those muscles just stay strong. You're going to create static lines, meaning that you'll get the lines at rest.
Right.
So it's super preventative in that. So what we do basically is very strategic points. It's very strategic. People don't realize that because when you hit one part of a muscle, another muscle might engage that's near it. So it's very strategically placed. There's a lot to it. When we train people, they're always like, wow, I had no idea.
Yeah, because it always looks to me that they're just poking it right in the
No.
wrinkles, in the wrinkles here. Or
No,
whatever.
not like
It's-
that at
yeah.
all.
No.
It's all based
This
on
is
the
why
muscle.
I don't do it. Just
Right.
saying.
Yes,
Yeah.
well,
This- yeah.
yeah, we can train you. I mean,
That'd be
it's not
great. Yeah, that'd be
legal,
great,
but
great.
we can
Yeah,
train you.
okay.
So, and honestly, I mean, you can treat so many different muscles in the whole face. I mean, Jemika and I know every muscle in the face by heart, you know, and we know the action of every muscle
Right.
because you can do just so many cool things with raising eyebrows up, opening up the eyes more, tightening up the chin and the jawline. I mean, there's just so much you can
This
do.
seems like I need a lot of this stuff. Seriously.
God.
Everything you're saying, I'm like, yep, I can use that. Yeah, I can use that.
Right?
Yep.
Honestly, everybody could.
Holy
you know?
crap.
You really could.
It's
And
unbelievable.
And younger people are doing it because we know that if you keep that muscle relaxed and it can't fully engage, it's not going to keep reinforcing those lines.
Hey guys, I want to take a second and thank Comfort Pro. Since 2001, Comfort Pro has been helping customers stay comfortable where they live, work, and play. They have 24/7 emergency service and a 100% customer satisfaction guarantee. If you need help with your heating and air conditioning or indoor air quality, call Comfort Pro at 484-917-1803. Mention the show and receive a free humidifier with the installation of a complete system. Interesting.
So, you know, I started doing it at 35.
But is there a point, and this is stuff that you hear, you know, is there a point where it looks like the person has no expression on their face?
If you do it that way.
If you do it that way.
Yeah.
So you could do it you can do it to somebody's face where it's like they don't look like they can smile anymore.
Right. You can freeze somebody's face if you want to.
Oh, that's not.
You absolutely
that's not
could.
good.
Usually
No.
their
That's not
forehead.
good.
You know,
But-
some people like that.
Yeah, some people do. But for the most part, if it's done correctly, no, it just looks like, hey, you're taking care of yourself. Your
That's
skin
amazing.
looks great. Like
Yeah,
you
yeah.
just look
Yeah.
like you're doing something.
Now, do you use it?
Of course.
And you use it?
Yes, I use a lot more because I'm much older. I'm much older than Jemika, so I'm often the guinea pig in our projects because.
So she's the one that like, I'll do it on her. She
Right.
needs it. Jeez.
Every time I'm usually
Yeah.
volunteering.
She's
I'm like,
always-
practice
yep.
on me.
Practice
Let's
it.
do it.
Oh my
Yeah.
goodness, that's great. So that's what. So you're picking out the muscles that need to be relaxed,
Right.
And then that's what makes it now. How long does that muscle relax for?
Well, typically, I mean, it depends on dosing and everything, but most people get about 3 or 4 months out of it.
Wow.
We concentrate our products, so we try to get a little bit more out of that. So
Yeah.
we're looking at like usually our clients will call to reschedule around the 4 or 5 month mark.
Wow, interesting.
Yeah, it's really cool. It's very
Now, does it all of a
scientific.
sudden just go and it's back to normal, or is it over time? It's just kind of
Gradual.
gradual.
It's gradual.
Yeah, that would be weird, right? All of a sudden you're
Yeah,
having
oh my
dinner.
gosh.
You're having dinner with somebody, all of a sudden their face goes, "Woo," and they're like all wrinkly and old looking.
Listen, although it doesn't happen like that, mentally it happens
It
like
happens
that.
like
You know,
that, yeah.
You look in the mirror, you wake up one day and you're like, oh my God.
Oh my goodness.
What the heck?
Yeah, wow,
Yeah.
that's crazy. Very
moving.
crazy.
Yeah, exactly.
No, it's
Super
okay.
cool, though.
So that's with that. So let's go into some of the stuff that you're doing. We'll get into
Sure.
what you're doing. You're doing the integrative health part of it.
Correct.
Correct?
Yes.
Tell me more about that.
So
Put Stanley away.
Put Stanley away. There you go.
Mary and I actually both do this,
Yeah.
but the integrative health is more that functional medicine. Functional medicine is considered root cause medicine.
Yeah.
A little bit different than conventional medicine. I think of it as a triangle for functional medicine. So you have optimization at the top,
Mm-hmm.
you have conventional on the left, and you have holistic on the right.
Yeah.
So all three together is what gets you the best health outcomes and optimization in your health.
Right.
So that's what integrative health is focusing on. We're focusing on getting answers and increasing that health span, not just the lifespan.
Right.
So I
So it's more about quality than quantity,
Right,
right?
exactly.
Yeah. Mhm.
So, you can have 78 years of life, right? Right now these numbers are skewed by COVID,
Mm-hmm.
but because of our lifespan, it was 78 years, I believe.
Right, for women.
For women. And then our health span was 60 to 63.
Oh,
so you get
interesting.
60 good years. So, most people spend those years working.
Shit, I'm almost there.
Right?
Wow,
and then after
seriously.
that, they're spending their time in waiting rooms, surgeries,
wow.
doctor's offices, appointments, pharmacies. So they were finding that patients weren't actually having a good health span. They'd get up to
And what's
60.
interesting about that is those are the years that you retire.
Right,
Yeah.
exactly.
So all of a sudden you work your whole life, you
Yeah.
get and you retire, and now you're really not having a good time.
No, you're just
Yeah.
sick all the time.
Yeah, it's crazy.
Functional medicine kind of is that next step to help patients increase that health span.
And what does that mean? What does that mean for me?
So, well, essentially we would look at, say you have these diagnoses, say you have an issue with gut health, right?
Yeah.
Say we're concerned, everything you're eating just making you not feel good,
Yeah.
you're feeling tired, you're feeling sick, brain fog, things like that. The functional standpoint will look at what's going on inside of the gut, whereas the conventional
And
standpoint.
when you say gut, we're talking stomach,
Stomach,
right?
in
And
the
small
stomach.
intestines, probably.
Small intestine,
Yeah, that's-
everything.
yeah.
Yes. So, we're looking at stool samples, we're looking at bacteria, we're looking at permeability of the intestines. So I don't know if you've ever heard of something called leaky gut syndrome.
Yeah, there's a doctor I just listened to on Ed Milet's show, and he goes into this. It was an hour of him talking about the whole gut thing and
Fascinating.
the antibiotics and what we've done with antibiotics and how we're
Right.
overusing them and how it used to be. The one thing that was amazing to me is how we used to have an antibiotic that was cultured for one certain thing, and then they came up with an antibiotic which basically he said was like taking a machine gun
Yep.
and blowing away
Broad
all
spectrum.
your
All
good
the way.
bacteria
Broad
and
spectrum,
bad. Yeah,
Yep.
the broad span. That's it.
Broad
The
spectrum,
broad spectrum.
yes.
Talked about that, and then he was talking about the postbiotic, which is yogurt, kimchi, and sauerkraut.
Yep.
I learned a lot in just this hour period, but it was amazing. That's the stuff he talked about, the leaky gut, and they're finding out a lot of mental health has to do with that.
Absolutely.
Because it does your serotonin. It kills your serotonin. It doesn't
Exactly.
enable that to work.
Exactly.
So yeah, Hugo's shaking his head over there. He's into this. I can
Yeah.
tell. Yeah.
Oh, it's amazing. It's
It
fascinating.
is
It
fascinating,
is.
is right. So
Fascinating.
keep going. So that's part of what you work on, or
That's
that you
part
look
of what I
at.
do, yes. So we kind of look at the body as a whole. We're looking at you not as just a patient. We're looking at your story.
Yeah.
So sometimes, like talking with patients, I can be in a room for about an hour and 15, hour and 30 minutes, getting a
Right.
full story as to where did all of this come from. And
Yeah.
some of the
There's a
biggest
lot
things-
for me.
Yep.
It's a lot.
Right.
Yeah.
But it all
a
all
lot.
plays into one, it all plays
Yeah,
into each other. But
absolutely.
if you go to see your regular family physician, do you start from the beginning with him?
Well,
or her?
I've known him from the beginning, so
right.
I've known him for a long time. But yeah, but no, you're right. Absolutely.
And that's kind of where we differ in
Yeah.
that integrative health approach.
Preventative.
Yeah, and
Yeah,
whole
it's all
body.
preventative,
Whole
right.
body,
Whole body.
from the relationships in your life all the way down to how often you're going to the bathroom.
Yep.
I mean, honestly, it's just
Yep.
because it's it's all encompassing.
Absolutely. Mental health is the big thing that I think everybody's talking about today. I mean, and a lot of it, we always thought that mental health was just all up in the brain. It's not. They're saying from the gut. I mean,
It's
there's
from the
things that
gut.
we are not cultivating.
Right.
Or we're killing.
Right.
That doesn't,
That we need.
yeah. And that's why we have people on anxiety medicines, on
Right.
ADHD and all these things. So they're just, I think, on the cusp of finding out what's going to happen with all that stuff. I think it's
exactly. I think
starting.
This is the way that medicine is going to go.
Yeah.
Functional
For
and integrative is the way that it's going.
But
to go.
they said there's trillions of bacteria in your
yeah.
gut. Trillions.
Right.
Like
Well,
that to me.
It's funny. Like they'll show these maps of like the gut microbiome diversity.
Yeah.
And that like in areas where they're eating more all natural foods and things
Yeah.
like that, their gut microbiome is so much more diverse.
Yeah.
And then you'll look at somebody from our area, and it's really there's just not as much diversity, and we need that.
Yeah.
I mean, it really is like an ecosystem in your gut, and
Yeah.
so all of these things, processed foods,
That's terrible.
it's awful what it does to the gut lining, and
Yeah.
so many of us walk around honestly with unhealthy guts, and
Yeah.
it creates this whole autoimmune. I mean, there's just all of these other issues that come from having an unhealthy gut.
And that's also where they're thinking that part of, with bread, what's it called?
Gluten.
Gluten, thank
Gluten.
you. Yeah.
Oh, gluten, yeah.
How can I forget that? It's like the word of the 10 years or the
Yeah.
century.
Yep.
Yeah, it's crazy. So that's what you're working on. So you do a whole breakdown then with somebody.
Yeah,
That's awesome.
Yeah, we start from the beginning. We do a whole breakdown, and then we work to fix problem by problem. Focus on what's causing the most issues for a patient, and then correcting things from there. Because
Awesome.
the body likes to be calibrated,
Yeah,
if you will. It likes
absolutely.
homeostasis. It likes to be balanced. So if we focus on the one thing that's making it the most unbalanced, all of the other things start to kind of fall back in line over time.
That's amazing.
Right.
Very cool.
Yeah.
Well, let's go into, you brought a book here that you talked about. It was called The Four Horsemen. And it was interesting.
Yep.
Yeah, that's it. I just looked at a little bit about it, but it talks about the four horsemen and what I guess is heart disease,
Right.
cancer, neurodegenerative.
Like Alzheimer's.
Yep. And then also type 2 diabetes or whatever.
Yep,
So obviously
metabolic
these are those like the four things that are basically
The big
are
killers.
the problems.
The
Yeah,
big-
the
right,
killers.
Right.
Yeah.
And 80% preventable.
Yep.
Isn't that amazing?
Yeah, honestly. I mean, we managed to heal so many people with antibiotics and with sterile technique and all of that. Kind of, really solving a lot of the main killers from centuries ago.
Yep.
And then we just created new ones. So,
Yeah.
and it's so behavioral, it's so related to behavioral health. I mean,
Yeah.
it's just, the actions and the choices that you make from, your day-to-day decisions about
Sure.
what you put in your body and your activity level. And here they're the leading causes of death. I mean, it's just, it's really unfortunate. So Dr. Attia talks about that a lot in his book.
And what did you say, the neurodegenerative disease is that Alzheimer's, you said? Alzheimer's,
Yes, right. Yep.
Alzheimer's,
Yep,
dementia,
Yep.
Amazing. And because that kills too.
Absolutely.
I mean, obviously it
absolutely.
does. Yeah. Obviously, yeah, it's amazing.
sure.
Heart disease is big. I have high blood pressure. I had it since I was 30 years old.
Right.
And that's one of the things that I have. I mean, it's one of the things that if once you have it, it's like I am medicated, but I'd rather have it than cancer than
Right.
something else. I mean,
Right.
but those are the four things. So what do you do? What are you guys teaching, or what is he teaching in order to kind of get rid of those 80% that's killing you?
So a lot of it just comes down to the basics, right? It's honestly, people complicate things. Even like all these biohackers who are bringing all of this attention to this world, which is amazing.
Yeah.
The Brian Johnson, have you heard of Brian Johnson? It's interesting to watch, but I mean, it's all encompassing of his life. Like everything he does is trying to promote longevity. It doesn't have to be that hard. It could literally just be removing processed foods from your home,
Right.
doing some sort of level
But that's
of
harder than what you
activity.
think, though. We are a busy people.
We are.
I mean, I just look at our family with, two kids. We have a 9-year-old, 12-year-old, soon to be 10 and 13. And dance, games, all these things going on. There are times when you just got to throw something in the microwave and eat.
Right.
Because, yes, you could grab an apple, grab whatever, but, that doesn't always happen.
So food prepping is huge, right?
Yeah.
So taking that time, everything, people will often say to me, oh, I don't have time to, because I do the nurse health coaching part. So Jemika's a nurse practitioner. She'll meet with the client, order lab work and do all of that.
Cool.
And then I meet with them twice a month, sometimes weekly, and just kind of like review all of those sorts of things. And they'll say to me, like, I don't have time for that. And I'm like, I promise
You mean like
you.
I just did?
Yeah.
Yeah.
And I'm
was
like,
just
I
gonna say,
promise you, if I have time, you have time.
Why don't you just say, hey, and there's people like you.
Yeah, right. No, it's a common thing,
Yeah.
but it's all like priorities, right?
Yeah.
And so, you can function so much better in your life, in that busy lifestyle, if you prioritize that.
Yeah.
Right.
So, it can be so simple. And if you make it just a part of your new life, you know what I
Yeah.
mean? If you just transition yourself, then that becomes normal.
Sure.
So it's just that we've created this normalcy in fast food, in not sitting down for family meals. Like,
Well, that we do. And actually, most of our
great.
meals, we do sit down and eat a dinner. I
that's
mean,
great.
almost, even when we're busy, we try to. Sometimes Catherine's on her thing doing whatever her thing
Right.
is, and then she'll eat when she comes back or whatever. But Jess typically prepares a meal almost every night.
That's
Except for Friday and
amazing.
Saturday,
That's
of
great.
course. Friday and Saturday, those are like the days you kind of just do whatever.
right, exactly.
But no, we do, and it's
Yeah.
usually broccoli and salads, things like that, and then also chicken and things like
you're
that.
not doing so bad.
No, we're not.
No,
we're not
you're
doing
not.
spazzy thing. I mean, I'm feeling guilty sitting here. I really do. I knew it was going to go this way. In my head, I'm going, oh God, I do that. Oh geez, I do that too. Oh my gosh, I do that. Are your kitchen and bathroom remodels a little overdue? Well, now's your chance to call First Response Contracting. John Sellers will take care of you. 484-256-7136. They do residential and commercial, and they're licensed and insured. Give them a call at 484-256-7136. If you followed me around, you'd be like, he is bad. He's really bad.
I try to tell people, look, if 80 to 90% is ideal, but 80% of the time, if you're doing a good job
Doing a
day
pretty
to
good job.
day,
Yeah.
and you know what I mean, then that definitely is contributing to the health. The exercise part, look, I'm like, I get up at 5 a.m. I go to the 6 a.m. workout because I'm at work all day long, and I know that's a lot, but that's like a whole hour of intense exercise. Like, it doesn't have to be that much.
Yeah, I do 40 minutes on the treadmill, fast walk. That's my thing.
Weightlifting, Brad.
Yeah, I got to do that too. Yeah, that's really good.
Walk on. If you
Jesus, I feel like I'm being drilled.
No.
Hey, Hugo, worst show ever.
You're putting yourself,
we won't be invited back.
You're making yourself vulnerable.
Holy shit, I look like this guy now.
I know, oh my gosh. No, this guy's
great.
lifting weights. His muscles.
Obviously. Well, here, I'll lift the 8 ball.
There you go. Perfect.
But no, I know weightlifting. I used to do all that shit. I mean, it gets out of your life, and then you got to get back in. That's the problem.
It is, and the thing is, people think like, oh, I'll just walk on the treadmill and all day long.
Well, I didn't even do that up until 2 years ago.
But that's good, though.
Yeah, so it's getting there. It's getting there.
Yeah.
But the weightlifting on so many other levels is just that much better. I mean, like even just in managing or preventing type 2 diabetes, right?
Yeah.
Glucose is taken up in the muscle first.
Interesting.
So if you are trying to control, and that's me being type 1 diabetic, like I'm very big on weightlifting because I know that my metabolism is going to be better.
Yeah.
My, my blood sugar management is going to be better.
Awesome. Right. So that's the thing. It's having more muscle mass so that the glucose is
for a million reasons.
Amazing.
Yeah. Even for women who are menopausal.
And bones too. I heard your bones,
exactly.
right? Yeah, that's
bones.
right. That's right. Heard
Health
that.
of your bones.
Amazing.
Exactly.
Yeah.
Phew, it's a lot. I'll tell you. Can we get into something that's more fun for
A little
me?
bit more fun.
Listen, I don't have anything fun on the list.
I've noticed that. The party was a lot more fun. It was a lot more fun there. But no, let's get into the GLP-1 the weight loss phenomenon thing. You hear good things, you hear bad things, you hear all kinds of things. I was reading even more of it just before you guys got here. I was reading up on a little bit more. And didn't realize that actually is one that they're also hypertension is kind of covered in that. And I'm guessing that's because of the weight loss. I'm thinking maybe, I don't know.
It is a cardioprotective drug.
Okay.
So it does help support the heart, which can help lower your blood
But isn't there a
pressure.
lot of other stuff that's bad with that or not? I mean, you hear all kinds of things.
I think there's a right time and a right place for it.
Gotcha.
Right. So it depends. You have to look at your patient, look at the story that the patient's telling you. Are they going to be a good candidate for these GLP-1s?
Yeah.
They are good in protecting the kidneys. They are good in protecting the heart. They are good in helping with weight loss. However, you have to look too, are you actually losing fat? Or are you losing muscle? Which is why we have developed a program with our physician and have taken a lot of time to build this program for weight loss to make sure that patients are working with Mary to sustain their muscle mass, right, and lose the fat.
Yeah.
And then once they get to a point that they're happy with their weight, you have to look at sustainability.
Yeah.
That's the other thing. People don't want to have to be on this medication for the rest of their
Somebody
life.
give themselves a shot in the leg or wherever.
Exactly. And I have seen physicians tell patients, no, you're going to be on this for the rest of your life. And it's, well, why do they have to do that? They're not going to continue to lose weight. They're going to plateau at some point.
Yeah.
But as soon as they come off the medication, then you have to worry about the weight coming back.
What's the normal, what do you lose on that? Like if somebody comes in, what do you tell them? 10 pounds, 20 pounds?
It's a variable.
5 pounds?
Variable. So I've seen patients lose, my family members have lost 60 pounds on this medication.
Well, then that becomes a major help to your health,
right,
obviously.
It does. And then it's, okay, now we're at the point, now you need to sustain the weight and stay off this medication because you don't want to be on this forever.
Gotcha.
So transitioning them to other supportive measures like diet and exercise, peptides, oral peptides are really big too to help with some of that weight loss.
I brought up the peptides earlier.
You did. Peptides
that was a word.
They
Jess
play
takes
a big
something
role.
like that with collagen peptide. It's what it
Collagen's
says.
great. Yep. Mm-hmm.
Does that come from a cow? Is that where it comes from?
So
Is it bones from a
depends
cow?
on what kind you're using.
It had a cow
Ours is
on it.
bovine,
Mostly
yeah.
It had a cow on it and it said
mostly
grass
bovine.
fed.
Yeah,
Right.
They're mostly bovine.
Pretty sure they didn't put the cow in there just for the hell of it. You know?
Listen, you just
Or is the cow taking it too?
right? Yeah, exactly. Or you want to look
I didn't
like
know
a
it
cow.
was
You want to
young,
be
yeah.
as strong as a cow.
Yeah.
I don't know. No, that's
so. And she puts that in, I guess, her water or something. My wife's a lot healthier than I am. She's really good at all that stuff. She should have been the one doing this interview. It would be a lot better, actually.
Listen,
But-
you can tell her skin is perfection. She looks
Yeah,
amazing.
she does.
So,
she looks
yeah,
great. She takes care of herself.
For sure, you can
She
tell.
does.
Yeah.
So the GLP-1. So you're getting a lot of people coming in for that, obviously.
Yeah, and sometimes patients too, just listening to what they have to say, it's like maybe you don't need that medication.
Yeah.
You don't need to go through that drastic dropping of weight.
Right.
And it does have side effects, right?
Yeah,
so
I'm sure.
the
Everything
first thing it
does.
attacks
Yeah,
is
of
your
course.
GI system. That's the
Yep.
first thing it goes after.
Yep.
So, and not a lot of patients want to feel like crampy abdomens all day long or feel like
that's
I have
not typically
diarrhea or nausea, right? Nobody wants to feel that
way. Not good for work.
Right, exactly.
Yeah,
so, it's...
But we microdose to try to prevent that.
Yeah.
So we're like, safely 2 to 3 pounds a week. So we don't let people drop off that much weight that quickly.
Yeah.
So we the way we have our memberships is if somebody has a decent amount of weight to lose, we're looking at 6 months or something because, we're coaching them through it and we don't want them to go off the medicine and gain the weight right back. So, so we do a microdosing. We're very cautious and gentle about it. And there's a lot of monitoring that goes into it because otherwise, you see this happening where people are buying it like street drugs. It's
with no monitoring. That scares me the most.
Oh yeah. It's crazy.
Exactly.
Yeah,
it's for business. They come to us and they're like, my cheeks are gone. And we're like, well, we're going to put a lot of filler in there to fix it,
exactly.
So I'm like, sure, you guys, go ahead.
We're going to give you the GLP-1 and then you're going to need stuff to make it look like you have a little weight on you.
Not our people, but hey, people on the outside coming in,
It has a name. It's called Ozempic face.
Oh my God.
Really
what is it? What it does, it makes them very drawn.
Yeah.
I've noticed that.
Because you lose your fat pads. You have fat pads in your face that hold things up. Yeah, they're important.
So much for the fat pads, huh?
I know. You can't win, right?
You
just can't win.
So what are these biohackers? What are those? Before we wrap this up, what are biohackers?
So that's like Gary Brecka.
But what is it?
Yeah. So basically, a lot of people will say it's kind of BS. You know what I mean? Biohacking. Basically, they talk a lot about just cellular health and regeneration, which is, there is a lot of research based on that. That's the whole red light therapy too.
Yes, so let's talk about that too. Let's get into that before we end up.
Yeah.
I want to talk about that.
Yeah.
The red light therapy. So this to me it came out of nowhere. And of course, I think right away witchcraft. I'm like,
right?
Yeah. I'm like, okay, here we go. Here's another thing that they're going to tell me that's going to do something. And is this real?
It is absolutely real. There's a tremendous amount of research. From you could look up National Institute of Health, and there's thousands of.
Why did we just discover this now, though? Who came up with this?
I think it just that it became more readily available, and somebody probably took the technology and was like, oh, we can make money. Capitalism just will catapult anything.
Absolutely.
For sure.
Yeah. So I think that's more so, and then plus two, other companies coming in and saying, hey, we can make these machines and sell them, and we can sell them to med spas.
It looks like a tanning bed in a way. It's
similar.
It looks
very
like that.
similar.
And you lay in there,
and
right?
You do, yep. And it gets
it's
nice and hot.
nice and warm. And I used to do tanning years ago. See, I'm telling you, I'm sinful already. I owned a tanning salon at one point. So it just shows you. Yeah.
I did not know that.
Yes, I did. I owned a
Wow.
tanning salon here in town. And, but it's funny, I learned a lot about stuff, a lot of things about skin and all that stuff. But with the red light thing, that's not, it's actually good for you.
It's amazing.
It's amazing for you.
Yeah.
So it just basically all of these treatment modalities, NAD injections, hyperbaric oxygen chambers, red light therapy, they all stimulate your mitochondria to produce more energy. So as we age, and especially in people with chronic conditions, your mitochondria stink. They just don't make as much energy. Your 10-year-old self would have made a ton of energy in your cells compared to yourself now. So basically, when those mitochondria do not function in a healthy way anymore, like cancer can come out of that, metabolic diseases, nothing in your cell is really functioning quite right.
Interesting.
So these will stimulate the energy in your cells, and it kind of will fix everything. So when people are like, what's the benefit?
So
I'm
it
like,
activates
everything.
them? Is that what it does? Kind of activates them or stimulates them?
It's
Is
like a recharge.
Interesting.
Essentially, yeah.
I would
you're
definitely want to try that
charged.
one. I want to. Well,
Yeah.
obviously,
Exactly what it's
definitely.
Yeah, so
Some
it
people more than
stimulates
others.
that. I know. Depends on the day.
Yeah, exactly.
I wasn't very electrically charged after the party.
Oh no, the next morning,
I wasn't.
definitely not. Well, that's when you need to do your IV therapy then.
Exactly.
Right?
Exactly.
Yeah. Oh,
And
we're always hooking each other up if we, not just,
for sure.
we don't ever drink really, honestly, but we do it if we're not feeling well.
Yeah.
We'll
Absolutely.
give each other
Yeah,
IV
absolutely.
vitamins. So it's awesome.
But so you're still normal people where you do have a drink here. I know you drink a little bit.
We're not perfect.
Okay, just making sure.
That's why I said 80 to 90% of the time.
So
Yeah.
there's a 10-20 that you're
Yes, there is.
that things are just off, not gone.
You have
It's
to
not
live.
good. Yeah,
It's and
exactly.
honestly,
You
with
get
these
one
clients that come through, I don't have them measure food. I don't
No.
have. It's about.
Do you like
lifestyle.
cheesesteaks? Let's just put that out
Yeah.
there.
I do, but I
do.
have celiac, so I can't have gluten.
Oh,
yeah,
for
so
Christ's
I
sakes.
know. Yeah.
You're
no
not
dairy,
a lot
no
of fun to
gluten.
be with,
No.
are you?
Oh, man.
Jeez, I'll tell you what.
Listen,
So
my
no
diet-
bread, no.
No.
Ugh. You can
No.
drink wine though, right?
Oh, thank God, yes.
Yeah.
Thank God. I'm like, God, thank you for not taking that away from me.
Oh,
but
that's
obviously
hilarious.
not too much.
No, I know. It's all in moderation. It's all in
Yeah,
moderation.
exactly.
For sure.
Well, I'll tell you what, this has been awesome. Definitely gonna have to have you guys back because we talked for 33 minutes, believe it or not. So we covered a lot, but there's a lot of stuff we can cover, I think, on another show. And maybe you will be able to do a little Botox on me the next time. I don't know. We'll see. We'll see.
We will.
Either that or we'll just get Hugo to do it. I mean, I just don't know what else to do. Yeah, we'll bring Jess in here. She can do it.
We'll have to give you a couple drinks first.
Drinks and Botox. What a combination, right?
Bubbly and Botox.
There you go.
Bubbly and Botox. I love it. All right, that's about it. Thanks, guys, for coming here. I really appreciate it. All right, there you have it. Skin Sanctuary, Med Spa, and Integrative Health. Mary and Jemika, man, what a great show that was. I did not get Botox done, but maybe the next time I will. We'll see. But we learned a lot, and I know some things I need to do. I need to lift weights. I got to do some other things. We'll see. I'll see if we can fit it all in. She says I can, but we'll see. All right, that's about it.